All right. Well, good morning, everyone. Uh, I'll just give you a quick thank yous. I'll make this quick. Just obviously thank you to everyone. Thank you to Dr. Wang, Dr. Levy for obviously bringing me into the program, and you guys taught me an exponential amount both in and outside of the operating room. I'm forever indebted to you, and I'll be sending you a lot of cases bothering you, I'm sure, over the years to come. I want to thank Dr. Green and Dr. Vanny, who are obviously both pioneers and legends in their own right, and getting to operate with them during their last months here at has been a privilege for me. And then Dr. Cote and Dr. Urikov, seeing what they've been able to accomplish in their young careers and balancing their family life has, been a big inspiration for me. Want to thank these three guys. I don't know if the other ones are here yet. Been a privilege to operate with you guys. I know you guys have big things in store for your careers, and so I look forward to continuing to call you colleagues. Oh, I guess one of my slides didn't load. I'll be going back to where I did my residency at New York Presbyterian Hospital at Cornell. Have pretty much all my mentors from residency are there. They've added Dan Rue from orthopedic surgery. So it's something I look forward to continuing. And I think my other slides got lost, but anyway, that's about it. I don't know. We don't have much time. Anyway, thank you guys.
Hi, good morning, everyone. I don't have any slides. I just wanted to say thank you to everyone I worked with this year, Dr. Levy, Dr. Vanny, Dr. Green, Dr. Yurikov, and Dr. Cote. And, it's been a great year. I feel like I've grown a lot as a surgeon. I think this fellowship's really special for a couple of reasons. One is the breadth and volume of spine surgery done here. I don't think you can find that at many other places in the country. The second thing is the opportunity to see what it looks like to see someone do our job on the highest possible level. And I think that gives us all a goal to shoot for and aim for, and sort of a North Star in our careers. And then, lastly, I just want to thank the residents. I can see why you guys are such a tight group of people. There's a lot of camaraderie, and I understand why. So thank you all. It's been a pleasure this year.
Slides. Ashish, he has the slides. Well, good morning, everybody. My name is Aditya Vedanta. I'm one of the spine fellows. I just want to take this opportunity to thank everybody. This fellowship is, I had some co-residents who had done this fellowship previously, and I think it lived up to what they said it was. I learned a lot. Next slide, please. I think the experience really, as Clay alluded to, was the variety of spine approaches and pathologies. I think the experience of being with different attendings is really valuable. Not a lot of spine fellowships have that. Definitely 1 year just focusing on spine, you get a much more nuanced approach. Now talking to my junior co-residents, I can see how much I've grown from when I finished residency. I had the additional opportunity of working with Dr. Levy and the Miami project, doing some projects on spinal cord injury and large kind of clinical trials. Very useful, something I'm interested in myself. And lastly, clinic, which is where most of spine surgery happens. I think we get a lot of experience here, and very valuable. As something in residency you don't get as much of. Thank yous primarily to the faculty, really let us operate on their patients as well as teach us. The residents and co-fellows, it's been a great experience working with all of you. I think this program really depends a lot on the OR staff and the X-ray techs, much more than others. And they've been very helpful also guiding us, and they kind of know what's going on. They've been doing the job for several years. The administrative team and clinic staff at have been great, especially getting our stuff for licensing and things like that done very efficiently. Next steps, I'm moving to Milwaukee. I spent some time there as a postdoc. I'm going back there. I'll be joining as assistant professor. I'll also be applying some of the skills I've learned here, and then carrying on the research I'm interested in, which is advanced MRI for spinal cord injury and cervical myelopathy. Thank you. Thanks.
Morning, everyone. I just put together a few slides. I was told that we had a very short presentation time. It looks like I caught the tail end of Aditya's, but his looked a little longer than mine. Anyways, So this obviously this year was a little bit different than in years past and what I had been told was the way that it usually went. But it started with we were still smack dab in the middle of COVID, and here's a picture of us practicing the 6 feet rule with Dr. Green, making sure that none of us got infected. This picture here in the middle is actually my first day of fellowship. I had some sort of delays with Jackson getting approved, so that was how I thought like the year was going to go. Just sitting on the beach with my wife and just watching my orientation slides from Fontainebleau, and then of course bringing the family down and getting to spend time with them, and it was actually kind of Miami in general was a very cool place, especially with the young family. I know that we had a great time. They probably came down 6 or 7 times, and it was really good just on a personal level. This is my case log. It's kind of hard to see. This was when I was going through my credentialing. I ended up probably around 150, 160 cases for the year. Overall, just my personal impression was that I did a lot more intradural work kind of than what I was expecting. I also did a lot more bigger cases than I was expecting from just like a minimally invasive approach. So it was very good in terms of techniques. Obviously, it was couldn't be beat. I mean, in general, this year, I don't think professionally could be beat. I had a very good time. I think that I learned a lot, and I'm very grateful that for this experience. I want to thank everyone that trained me while I was here. This middle picture, a lot of these people are barely recognizable now, but anyways, it was I just wanted to thank y'all for just a wonderful year. And I will be headed to Houston Neurosurgical Group of Texas, based out of Houston Methodist. So thank y'all.
Morning, everyone. I'm Robert Rothrock. I'm technically a PGY 7 from Mount Sinai, although this is my nice interlude where I'm technically a postgraduate fellow for like 16 days. Hopefully my slides will come up. Okay. Awesome. So thank you all again for having me and letting me speak this morning. It's been a great year, and I just want to thank everyone for welcoming me so warmly from day one here during what is effectively my PGY 7 year. This year has been marked by some interesting and challenging cases. I think all of us, when we look for fellowship opportunities, want challenges and to push beyond the boundaries we may have known prior. So these are just a few select cases of the sort of pathology we have access to with this catchment and referral base here at University of Miami. So on the left, you see an odontoid screw, which is something that I went through all of residency not having done. I guess the slides aren't up here. All right, that's okay. I don't want to slow down today's talks. Basically, I just, again, want to thank everyone for the opportunity to be here for the year and for welcoming me so warmly. I've had an amazing operative experience. I didn't put my case tallies here, but I've done 265 cases this year. I've had many opportunities, so you can't see this picture here, but I had pictures of me doing a great example of the sort of growth opportunity you have here at Miami, which is a true investment in your education, not just about the cases. It's not just about the logistics, but here's me doing Dr. Wang's famous nail board. So for those of you that don't know, you don't know how to use a hammer, just so you know, and you learn by doing repetitive motion, right? By getting that tactile feedback. So Dr. Wang often says, listen, if you really want to master something, go and do it. So he says, put 1,000 nails in a board. And I'm sorry, I only did 700, but this is me. That's true. So this is me. Exactly. So this is me in my parents' backyard doing this. And, I wasn't sure how my parents were going to react to my doing it. And what the reaction was, though, was, wow, if someone's having you do this, they must really care about your education, right? This goes beyond just being in the operating room. It's about discipline. It's about mastery. It's about fine tuning, right, in a fellowship. So thank you, Dr. Wang, for pushing me, and Dr. Levy during my time with you both. Am I able to do this now? Or... Okay. All right. And then the next slide was just friends new and old. So, you know, I've known Shelby and Ashish since being on the interview trail 7 years ago, and it was an amazing opportunity to kind of watch them finish out residency, and Ian get to know him this year. And so this is me and Shelby doing a robot case. You can see new friends, the robot I'm not so sure on yet on the right panel there, but having access to all these modalities is really a powerful thing here. And then if you could just go to the next slide. I just want to extend finally a thank you to Dr. Levy, Dr. Wang. Myself and Slava had a bit of a different track this year. We spent 6 months with each of these two consummate academic surgeons, and really thank you for taking the time, energy, and investment and over the course of this year. Sorry for all the technical difficulties. Thank you again.
Morning. Sorry, I'm not there in person. But I just want to thank all the spine faculty for accepting me to the fellowship, and then, you know, Dr. Wang and Dr. Levy for allowing me to spend 6 months with each of you guys. I've learned a ton. This year has been amazing, both professionally and personally as well. All the residents, you guys welcomed me there as well, and I've learned a lot from you guys too. Obviously, the OR staff of both Jackson and University Hospital has been great too. So thank you everyone for having me there and allowing me to grow this year. And that's basically it.
Apologies for not being there in person. My name is Lisa. I'm the outgoing neurotrauma critical care fellow. Next stop, I will be headed to California, going to join the group at UCSF. Go ahead and just pop through these next two slides real quick for me, please. These are my cases. Operating wise, did a lot of cranies. Maybe didn't get as many cases as the other fellows, but next slide, please. If you, but my experience outside of the operating room doing bedside procedures, I think I made up for it. So I ended up with a total of 144 cases and procedures, which I think, considering the variability, was a pretty good load. So some of the highlights of my year this year, the big things for me that I really enjoyed about this year were learning new and different techniques. Got to learn how to use jiggly saw and place Lycox. The pathology I really enjoyed, both the severity of the injuries that I saw, as well as the variety in the pathology. And then finally the people that I've been able to work with this year and learn from was very meaningful. In particular, Dr. Jag and Dr. Grazioli, and then also Dr. O'Phelan and her team of phenomenal neurointensivists. Next slide, please. Then outside of the operating room, you know, we arrived here in the middle of the pandemic as a family of 3 with 2 dogs. And then next slide, or advance, please. And then we will be leaving here as a family of 4 with 1 dog, and on to our next adventure. So grateful for the experience that I've had this year, and the things that I've learned, and the good memories that we've made here in Miami, and looking forward to what's coming next. Thank you.
Hey, everybody. Yeah, exactly. Good morning, guys. It's kind of surreal to be up here, to be honest with you. It only felt like just a few weeks ago, we were already seeing Simon, Angela, and Karthik do the same thing, and sort of this year just kind of flew by. So it's just a remarkable to be here and to share this with all of you guys. So these moments for me as a junior were more focusing, remembering on, and cherishing the people that were up here talking. That the other day when I sat down to start to do this, I didn't remember what the format of these talks was supposed to be. It was like you get so sort of absorbed into what people are saying and their history, and you're like, oh wait, no, I'm supposed to do this and put this together. So this is my attempt at recreating what I remembered a lot of the other people that came before me doing. So it'll be my attempt of telling you how I got from A to B, at least to be here. So I'm from a really small town on the west coast of Puerto Rico called Aguadilla. And that little corner there, it says Aguacate. That's the name of the barrio that I'm from. Very small town, about 26,000 people. And in that town is supposedly where Columbus landed on his second voyage to the Americas. It was a town of Aguadilla, which means the village of water. And it was called that because there's fresh water spring in the downtown area where it's supposed to be that they first had their fresh drink of water on the path from, when they first reached the island. This is a really amazing beach called the Crash Boat, which is from an old wreckage that from the time that the U.S. Army was there during World War II. It's actually got the largest airport in the Caribbean, which we don't actually use other than from the hours of 2 to 5 in the morning nowadays, which is where I just picked up my mom in Fort Lauderdale. She just got in. But they used to fly in all the bombers and cargo planes into the west coast of Puerto Rico, and that's how they would get stuff into the Caribbean for during the war. So many years ago, this man and this woman met, and my grandfather took this picture, and it's got a really funny story. So this is my dad and my mom. And for the longest time, my grandfather being very traditional, he would have my dad stand outside the house, like outside the fence, whenever he wanted to visit my mom, and he would never let them come inside. And so this is years into their relationship. He finally lets my dad come into the house. And here is my mom. You can see her happy face, right, when she's taking this picture, because my grandfather would then sit there and chaperone them the entire time that they were visiting. I grew up with my mom and had a sister, Yomari, which 6 years older than me. You can see me here, my first attempts at scuba diving on the right side. And unfortunately, around this time, actually, I was just 7 months old. My dad passed away from an airplane accident. And so it was my mom, my sister, and I. And I was very fortunate that my grandparents kind of stepped up to the plate and just kind of took me in with my mom to sort of raise me. And here's my grandfather holding me shortly after my dad had died. Fast forward many years later, you guys know I'm a pretty nerdy guy. Went to high school in that town in Aguadilla, 20 kids in my school. You can see me here. I don't know if you can recognize me. And here with my other classmates. And of course, being the geek that I am, this is me at the science fair, converting waste from the kitchen that I took to make batteries to power a little radio that year. I think I was about 14 at the time. In high school was one of the most defining moments of my life was my friend Juan Carlos, who in that same beach in Crash Boat, jumped off one of these piers into the ocean and ended up becoming a quadriplegic. And this is me standing next to him here in graduation. Very good friend, cared for him a lot, and really changed my perspective on how life can change so quickly. So I still stay in touch with him, and he's a remarkable individual that motivates me every day. 'Cause he's now like a patent attorney and lives on his own with his wife. And just goes to show you that a lot of the limitations we have are up here in our heads, not physical. And here we are. Despite his injury, he would come to our pool parties and hang out with all of us. He's here in the middle. So, fast forward, finishing high school, I ended up, it was the first year you could apply online to MIT. That's dating back quite a bit. You guys know I'm a little bit older than the rest of the chiefs. I submitted an application on a whim. I was going to go to the University of Puerto Rico because it was 30 minutes from my house, and surprised that my application through the internet went through, first of all, and second of all, that I got in. So ended up moving to Boston at the age of 18, which really just opened up so many doors in my life. I spent a lot of time. I found these group of guys that loved the environment and wanted to build cars for the future. And I spent a lot of time. Here's me driving our solar car chassis here with, you see all these lead acid batteries. There's a ton. And this is us in Australia in 1999. Actually, at the end of the World Solar Challenge, where we finished first in our class in the world, and like 8th overall. We came in 3 hours behind a team that had spent $3 million on their car. We were only 3 hours behind them after 5 days, and our car was only $300,000. And this is me with my mom and my grandfather when they came for graduation. All this time, I really loved engineering. I liked working with my hands. I thought I wanted to work on sort of telecommunications and applying things to make sort of space travel and all these things doable. And I had always tried ever since I was a freshman to get into JPL for an internship. And it was in the summer of 2001 that I got the chance to go there and actually work on this project that you can Google. It's called the Interplanetary Internet. I was like hacking together a couple cameras in the lab so that we could point a laser light from across, Earth to Mars and kind of track it. And then you could send data by pulsing this laser. And I was like, I thought I'd reached the pinnacle of what I wanted to do with my life. Turns out at the end of the summer, I had a great summer. But at the end of the summer, I'm walking by my advisor's boss's office, and I look in, and like he has a slideshow on where it shows one is this really powerful laser sending data from one place to the other in Mars, and then it's a powerful laser pointing down at Earth and something being set on fire. And I was like, nobody told me about that. That's kind of not really what I wanted to be doing with the technology that I'm developing. So really kind of set me back. And I was like, went back to school as a senior. And I was like trying to pick a senior's thesis. And I came across this neurologist at Mass General, Steve Massaquoi, who was applying the same math and techniques that I was using to build these control systems to actually understanding the nervous system. And so this is my thesis. I ended up thinking about, because of my friend Juan Carlos, about how we could begin to model the spinal cord as a sort of component that you could begin to understand the signals that come in and go out. And so this is like a block diagram from my intro thesis as a master's student. Clearly, I had no idea what most of these things did as an engineer. I had no medical training at this time, but you could begin to think about it as like a mechanical system with all these actuators, and the body to be able to move needs to get these electrical signals from the brain to the body. So this was in the process of doing this and starting to learn more biology and seeing this role model that actually was a clinician and a scientist. I began to get really excited about medicine and decided I want to go to med school. And when I did that, I got everything sorted out and I had this plan. And then I told my mom, you know what, I'm just going to take a year off. And while I sort this out and apply to medical school, they thought I had lost my mind. Here I am, like finishing a master's degree at MIT and getting a PhD started to kind of think about more of these things. But I'm like, no, I'm just going to put everything on pause. And I moved to St. Croix on a whim. I went on Google and I Googled dive shops. And then I Googled the name of different places I'd like to live in. And I ended up calling them, like cold calling. Hey, would you guys hire somebody who's interested in like learning how to dive and work at your shop? And these people said, yeah, sure, come down. So I got on a plane and I flew to St. Croix, and I spent a wonderful year there as a scuba instructor. There's a picture of me with my students, just showing them how close you can get up to a stingray. Had an amazing time and really learned to value what it's like for people to pay you to think. And here I was getting paid now to mop the floors, fold the t-shirts, balance the cash register, clean the boat, haul the tanks. It really gave me good perspective to come back to medical school and really focus and get the most out of it. So I finished in 2014. It was just before that, during my PhD, for my defense, that I met my wife. Actually at a bar in Boston shortly after one of my experiments for my PhD wasn't working. And serendipity, you know, here we are so many years later. On match day, I was super excited to find out I was coming to Miami with my classmates. And, you know, then this wild ride that is neurosurgery residency started. I was very lucky to start out on neurology to kind of ease in. Everybody was concerned about the old PhD and like his clinical skills. And is he going to be able to, you know, Victor might be able to resonate with that. Everybody's like, oh, I'm not so sure. He's kind of old. Just give him a break, see how he does. So I started on neurology and then eased into UMH, which was amazing with Rick and Carol, and Timmer was my PGY3. And here we are. Carol and I are basically, you know, very, very similar, as you guys know. I'm just studying from Greenberg and she's doing her thing. Not a lot of operative cases that year. As you guys know, as an intern, it's kind of difficult. A total of 74 cases, but I learned so much about managing patients. And really, I think people started to think that this old guy might actually be able to make it through residency, and gave me a little bit more trust. As a PGY2, I got to go to the run course, which you can see here, and actually spend some time in Heroes Clinic. This is the first NPH patient that I had that actually got better, and she wanted to take a picture with me. This was the year that my translation skills in Spanish became useful. And so here I am on TV with Dr. Peterson, just because I could translate what they were saying. I didn't actually do much for this patient. And then this is in graduation with Ashish and Shelby, my brothers in neurosurgery. And yeah, overall it was a great year. I got a little bit more in the OR, 147 cases. And then PGY 3 years, really a year where I think I started to grow up and get a little bit more confidence in the OR. I had 304 cases. It was a very defining year for me as well, for what I'll mention in the next slide. But it was the all Puerto Rican team at UMH. We had Giancarlo, Roberto, and me. So there's a lot of Spanish being spoken around there. Here we are in our shunt revision, all three of us scrubbed in. And of course, Komatar doing his daily rounds as usual. Got a chance to be at Children's with Dr. Bhatia and Dr. Ragib. This was like the first day I was there, it was just after Halloween. And just such a remarkable individual, Dr. Bhatia, and his passion for epilepsy surgery and just surgery and patient care in general was just something that I still carry with me today. And it was the first time that I actually could connect all the electrical engineering stuff that I did with like surgery and the brain. And I was like, oh, this is cool. I can kind of start piecing this together. Before it was like these ideas that were so separate. This was like the first year where I kind of saw a path that I could travel. As a PGY4, it was it was my enfolded fellowship year with Dr. Jagged. I did a total of 209 cases, but as you guys know, the functional fellowship does afford you some time to travel. So I went to Oktoberfest in Munich with my wife. It was also the year that I started going around to the different rehab places here in Miami-Dade, try to recruit patients for our clinical study in spinal cord injury for the brain-machine interface. So I would go to the different support groups and meet patients and talk to them about our research here. And then that was also the year we were all stuck at the UMH for the hurricane. So this is a picture of basically the entire neurosurgery program stuck at UMH for about 4 or 5 days. We had a great time. There's some incriminating videos still floating around from those that I didn't want to show. And then also just, more time to spend with my co-residents. Like I said, I did the Enfolded Fellowship with Dr. Jagged and had a great time. And he's been such an incredible mentor through fostering the ideas that I've had to kind of push into reality. And just, really amazed as I was looking at these pictures, just in the midst of, all the stuff that is neurosurgery, all are pictures of family and smiling and sharing. And I think that's really unique about us here. It's just that we're all just a big family. Of course, PGY 5 year was my research year. Very few cases there. That was the year that Simon got married. Karthik, of course, always taking the food at the resident conference. And again, spending more time doing research with Dr. Jagged. This was a year where I actually, from the last year that I'd spent all this time looking around for a patient to do this brain machine interface study, this was the year that we actually got to perform the implant and actually drive home some of the clinical results. This is a German. This is our volunteer for this study. He's just an amazing guy. We spent a lot of time together in the lab trying to understand his needs and what we can do with the technology we have today to kind of help him in his daily life. PGY 6 year was sort of a blur because we went from 57 cases to 335. It was the year that Ashish had and Payal had Kush, and we had Jonathan, and everybody was very supportive in the process of becoming a new parent. I remember my wife coming into the hospital one day, and I was about to start it was a Thursday. I was about to start a acoustic with Ivan, and I'm about to pin the head. Patient's in the lateral position. I'm about to pin the head. I'm with Samir in the room, and my wife calls and says, like, I think I'm bleeding. I think I'm losing the pregnancy. I think I have to go to the hospital. And I remember just like my heart sinking, and I turn to Samir and is like, my wife, first of all, never calls me, and she calls me like this. I'm like, okay, this is super serious. Turn to Samir. And he sees my face. He's like, go, just go. I got it. And, that means a lot, right? You have people that just get your back and understand that life happens sometimes. And then PGY 7 years has been amazing. I've been very lucky to have great residents to work with. There's Badu and Damien taking out a little, I think this is a scalp lesion at UMH. We got the COVID vaccine. Got to spend some time with Dr. Levy and the chiefs. And of course, spend time with Greg Basil, and definitely just watching over the curtains here as he critiques Badu's shunting techniques. Much busier year. As of yesterday, a total of 1,470 cases. And also really fortunate to be able to spend Dr. Green's last cases with him. This is actually the last case that he scrubbed doing his dance. I was really fortunate to share that moment with him. So I thought I'd leave a couple of thoughts for the juniors. Things that I think were important during residency that have kind of helped me in retrospect what they were. One is just to be curious and not settle for the status quo. A lot of my best experiences here have been on the research patients and trying to do things that haven't been done before. And I think that as neurosurgeons and neurosurgery residents, we can really move the needle forward if you just take your passion, which you all have, and apply it to something you're passionate about. But of course, be ready for the roadblocks. And I think Einstein said it best, that if we knew what we were doing, it wouldn't be called research, would it? And just to take that point home, I know a lot of people really enjoy the Miami Project lectures here that usually come in the second hour, and we have to go pre-op, and you're always like, oh, should I stay? They're talking about all these pathways. I don't know what's going on. I got to go consent and pre-op these patients. So about 3 years ago, one of the scientists here presented this video of this rat with a spinal cord injury walking on a treadmill, or not walking on a treadmill. And he said, but we have this little place in the brain that in the brainstem that if we stimulate it, all of a sudden the rat could do this. And you guys now know my background. So I've been trying to do this for 20 years. And I was like, well, how in the world can we try these with humans? And we said, well, I started looking at the literature, and it turns out that that little nucleus you're tickling there is right next to the nucleus that they've been trying to tickle with DBS for freezing of gait and Parkinson's disease. And so we said, wait a second, maybe this is the right place to tickle for Parkinson's disease, because the results in that pedunculopontine nucleus aren't so hot. So maybe they've just been targeting the wrong thing. And this would allow us to, first, FDA wouldn't let us do this with a spinal cord injury patient. So because this is so close, if we did it with a Parkinson's patient and they got better, we could prove safety. And maybe in 5 years, we could try it with a spinal cord injury patient and actually show efficacy for SCI and actually take these things to the clinic. So we kind of hustled, and we put together an FDA IDE and got industry funding, and we implanted our first patient in this nucleus last year, or actually this year in October. And he's got very bad freezing of gait. As you can see, it takes him almost a minute to make this pirouette test. And we were able to plan the surgery, again, a surgery of targeting a nucleus that nobody's really targeted. And we worked with Dr. Jagged, Dr. Luca, and Dr. Noga and Guest. And we implanted this patient, and now you can see him post-op actually being able to move his legs like that. And so now we're in the process of trying to complete the study to show that this is safe and efficacious for Parkinson's, but maybe this is where we can go now, taking these results of this rat here that actually made it off the treadmill. I don't know if you saw that. It actually gets out of the harness and walks. Maybe one day we can do this in the near future with our patients with spinal cord injury. And again, so I've learned so much from German in the process of doing this study that, I think to make somebody's life better through these incremental changes that we can do, that's the beauty of medicine, right? And we have a really unique opportunity to do that. And I encourage all of you guys to think outside the box, stay curious, and just, try to move that needle forward. So what lies ahead? I'm going to go actually in a week. I'm moving to San Francisco to do epilepsy and functional and stereotactic neurosurgery. Really excited about doing a lot of open epilepsy with Dr. Eddie Chang, learning about functional mapping, and they also work on brain-machine interfaces. So really just learning more about how these technologies can be applied in the future. And just want to leave you guys with some parting thoughts to the junior residents. So, always remember, in the midst of all the hard stuff that happens in neurosurgery, it's easy to think about where you can cut corners, where you can maybe go home 5 minutes early. But always remember in the end to do the right thing. You can find efficient ways to do the right thing, but never do the wrong thing at a cost just because you're cutting a corner. Oh, wait, and then this one I learned from Dr. Green. Treat your patients like you like your family to be treated. Everybody for Dr. Green is a VIP, right? And we should aim to treat our patients like our family. From Dr. Heroes, always be intellectually honest. Don't cancel the case in the middle of the night because you're waiting for the magnesium, or say you need more labs, right? Be honest with yourself about what needs to happen and what the right thing to do is. And also, it takes a village. Everything we do cannot happen without everybody that's here, right? The infrastructure of our colleagues, the nurses, our family in and out of the OR. remember that. You can be the person that's driving the ship, but if there's nobody on the ship, there's nothing to take anywhere. You're not going to get anything done. You got to get everybody on board the ship. You got to keep the village motivated to support you, and you need them to help you. And it's really sort of not just you and what you need to do, but rather what we need to do together. After every case, and I remember I learned this a lot from Simon, every case, regardless of what the case is, it could be a shunt, it could be a biopsy, always think about something you could have done better and try to do it the next time. It keeps you focused, and it helps you kind of get past that thought of, oh this is just another whatever case that I'm done like 10 of, 15 of, I've totally mastered this. There's always something that can be learned. From Dr. Morcos, I've learned that neurosurgery, you need to be meticulous, and you can't let outside factors have you deviate from that. That's when mistakes happen. It's remarkable to see Dr. Morcos operate on his 7th case at 1 a.m. with the same tempo and character that he operated on the first case. You know, don't let those outer influences affect your decision-making and your skills to take care of your patients. As a chief, with great colleagues and residents, and being more of a leader, it's always a struggle to trust. You got to learn to trust and build confidence, but always remember that the more responsibility you have, the onus is on you to verify that those things are correct. So, you know, build people up to trust, to be trustworthy, but that doesn't take the responsibility from you to make the ultimate decisions. So just verify things for yourself to make sure that you have all the information. And really, one thing that's really important is that the more senior you get, the more responsible you are for the juniors' education, and take pride in that. Take pride in teaching your juniors something that you should have known that you didn't know when they were at that stage, so that you can make the next generation better. And so with that, I'll say thank you. I'll say thank you to all the attendings. Now I can go one by one, but just know that I carry with you guys a lot of great experiences and skills that I've learned and I take to heart. And I'm very thankful for your teaching and your time. All the staff here, Ingrid, is like mom, really helps with everything. Swazo, can't mention the number of times Swazo came to the rescue with videos or slides or pictures. Andres and Brittany and all the staff here that have been so helpful. Yasmin with Dr. Jagged when we're doing the fellowship. And then my co-residents, the ones that have already graduated, and all the juniors, you guys know that really proud to be here with you guys. And it's really an honor to be part of this program. Thank you.
The story of my life is never to follow Ian, so I have a little bit less kind of exciting journey that Ian did, but you know, I'll kind of hopefully summarize a little bit of that here. You know, I've known this department for the last 11 years, probably maybe 12, 13 years since I've been here in Miami as an undergrad. I titled my chief talk "Mountains Beyond Mountains," which is kind of a Haitian proverb, kind of describing that every mountain you encounter, there's another mountain. And I think that accurately summarizes neurosurgery and kind of life in general. You know, I think that this is neurosurgery, an incredible learning opportunity, and you know, I think this adequately summarizes that. My story kind of begins in 1983 with my parents, who were from a very conservative area in India, Gujarat. You know, this is kind of a dry state, you know, no alcohol, no drugs kind of thing. And my parents got married there and kind of came over to the United States at that time. And at the time, my mom was, she's the Brahmin caste, which is the highest caste, you know, very renowned. My dad was kind of this lowly businessman caste. So they got an intercaste marriage. And, you know, like Stephanie says, you know, they were staying woke probably at the time back then. You know, so they came over here to Texas, South Texas. This is Corpus Christi, probably the best picture of Corpus Christi, probably. But it's like a sparkling city by the bay. It's kind of South Texas, kind of close to Mexico. I don't know why this map got rid of Mexico at the bottom, but it's there. You know, it's a pretty unique city, 300,000 people, very nice, like kind of homely area, but good Indian population. So I was able to kind of have some of my roots with me at the time. My parents, you know, like every Indian parent, and so I'm sure a lot of Asian parents as well, kind of have the same story. They came over here with $20 in their pocket and they didn't have a job. My dad was an engineer, but you know, nobody accepted his degree. So he started working at this gas station, Tenneco. And what I noticed is the gas prices were like 69 cents. So that's, you know, it's pretty nice. And my mom was working at an igloo factory, you know, making these igloo like coolers. And, you know, slowly they kind of moved their way up. My dad, you know, put himself through school, through engineering school, was able to start his own business and kind of helped, you know, raise us in that way. So I was very fortunate to their work ethic to kind of get me where I am. And, you know, I think every kind of first generation person who comes here to the United States kind of has that story. And that's what makes this country so great. In 1989, I was born. I was a little fat kid, about 8.5 pounds. My mom, she couldn't push me out, so we got a C-section. I think they like intubated me when I was born because I couldn't maintain my airway. You can see that neck. And my brother, you know, he was 3 years older than me. He was never been happy, you know, never happy, you know, since I was born. He told my mom, sent this kid back to the hospital. We don't want him. And I think my son has the same characteristics because I was holding, you know, Stephanie's kid the other day and he was like, no, no, no. So I don't know, we'll see. You know, I think it maybe runs in the genes. Growing up, I grew up in Corpus. Corpus is a unique city. They have the home of Whataburger, which is the kind of fast food kind of chain in Texas, very, very famous. Selena Quintanilla, you know, Jennifer Lopez's movie, you know, she was born in Corpus and she did all of her singing all in Corpus. And that's kind of our pride. And we also have the highest teen pregnancy rate in the United States. So that was some highlights. This is me, you know, high school, trying to be a cowboy. I drove a red BMW with like these kind of spinner rims on it. And I thought I was probably the most, you know, cool kid in the world. And, you know, and looking back, I regret it, but I like the car. It was like, I think in 2007, I was applying to all these baby dog programs, kind of a common thing in my area. Like, you can kind of apply to these programs. My brother did one, and like basically every kid in my community did one. And so I ended up applying to University of Miami in 2006. I came here for the first time. This is Key Biscayne. Before, I guess it was really busy. I don't know, like in February 2007, I was sitting on the beach. I love this campus. It was a beautiful day in February, and I was like, I absolutely have to come here. And here is kind of where I met my wife. We met on the Indian dance team. I actually flew her with, like, you know, this is cheap at the time. It wasn't that expensive, but we got some plane and flows to the Bahamas, and I kind of, you know, secluded her so she couldn't run away. So it was a great time to fall in love. I started an Indian fraternity. This is our South Asian Indian fraternity. We started back in 2008, and it still exists now. It's one of the very, very proud of this. You know, we have about 100 or so brothers that they're, you know, committed to service, and we do some benefit dinners for juvenile diabetes research and for Haiti. And, you know, I continue to mentor them. There's a lot of them have come through medical school and have graduated now from medical school and are graduating from residency. So it's an impressive journey to kind of mentor the next generation of kids coming through. But it was through the fraternity that I kind of met Dr. Green. And so we went down there to go donate these computers to set up a kind of a computer kind of kiosks for kids down there. And we donated 50 computers, and we were going down there taking blood pressures. And I met Dr. Green. Like, I didn't even know he was going on the trip. And he was kind of prescribing albendazole to some kids down there and some hypertensive medication. I was like, what do you do for a living? He's like, oh, I'm chairman of neurosurgery. I was like, neurosurgery? I was like, why are you in rural Haiti? And I was like, at that point in time, he's showing me his phone. He's like, Justin Bieber was in his contacts. And I was like, this guy's amazing. He has Justin Bieber. He has like Gloria Estefan, and he's like in Haiti. I was like, and then, then you get to know Dr. Green, and the amazing person he is. And I was so bewildered by him at the time, and I was like, I want to be like this guy. He's a humanitarian, he's a neurosurgeon, he's chairman. So many things. I looked at him, and you can imagine how impressionable you are at that age. So I thought that I'd continue my work in Haiti, and and when I came back to Miami, I was like, I started to shadow him, in the OR, and spend all the time in the world kind of shadowing him. I think it was that summer I graduated from undergrad, and this guy, if you guys recognize him, is Paul Farmer, was talking at my graduation, and he kind of, chided us for being University of Miami graduates. He was, kind of saying, you guys got to do a little bit better. And, that kind of, resonated with me that, even though you feel like you're accomplishing something, there's always the next thing ahead of you. And, and I think that kind of resonated with me a lot. And so I started medical school with Shelby. We have had a great time together. I think we were friends from first year of medical school. His girlfriend at the time did not like me, so we kind of were apart for a while. But we kind of rekindled our relationship back in at the end of medical school. But we were good friends, and this is us in graduating from medical school, and we were a lot younger and a lot more bright-eyed. I think at the time, first year of medical school, my wife ended up giving me this handbook of neurosurgery. It's kind of a gift saying, do what you love. This is your passion. I want you to, pursue this. I'm 100% with you no matter what. And that kind of meant the world to me. These are the chiefs that I was introduced to when I was a first year medical student. The first case I scrubbed in was Dr. Green comes like, hey, Ashish, are you free? I said, yeah, sure. He's like, can you come to the OR? I'm like, OR? I'm like, I've never scrubbed into a case before in my life. So I run over there, and, it's like Chris DeMassi's under the scope. There's like spinal cord open, like, everything, like the cutting arachnoid. And he's like scrubbing, just help him out. I'm like, help him out. I was like, what? I never, put gloves on. So I put the sucker in, like immediately, first thing I did was like, he kind of pushed in, and he's whoa. And I was like, okay. I was like, but that's when you realize what neurosurgery is. And these guys kind of, these are the guys that kind of, introduced me to neurosurgery. And, it was fun to kind of learn how the program was, I think of the day with these guys and, what it was. My first year of residency was with Faraz as my chief, and Gabe was my chief at UMH. But this is a note that Walter wrote to Faraz. I don't know why he wrote this, but it says something. It says, "Don't become a suicide bomber. Kill the others, but spare yourself." I think we lost it. I don't know why I found that in my. Perfect. That was the end of that. Okay. Hold on a second. Here we go. So I learned my intern year that stuff always rolls downhill. This is a case that me and Shelby ended up doing because nobody else wanted to do it. We were intern. It was a prion disease patient. So they're like, no drill, nothing. You have to use a Hudson brace. This is me, making this burr hole with a Hudson brace. We never used one before, and taking this biopsy. I don't know why we're taking pictures in the prion disease room, but we did. And this is Dr. Hiros's Hakim valve shunt bag. I'm so glad I never have to see that again. Changing those valves is extremely painful. This is the time where the interns don't remember this, but fiducials, you had to put fiducials on patients. I put fiducials on the neck. Nobody told me that you can't do that. So Faraz took a picture. He said, this is unacceptable. And this is I think this is like 6 people doing an EVD. You can see there, like, this is, some learning curves. PGY1 highlights. I imagined to put a JP through a patient's forehead of Dr. Komatar's. It was infamously called the unicorn drain. Dr. Komatar and Giancarlo ended up doing a lumbar drain for me because I had to go to my best friend's wedding and I was an intern. They were like, no, don't worry, we're gonna come in. They left graduation to go do this drain in the ER for me. And I'll never forget that. That shows you the family that we have and how much we protect each other. That the attending and the chief resident would come in and do like a lumbar drain for the interns just so they can, attend someone's wedding. And so that really meant a lot. Learning to close was a big thing. I was really scared about like closing skin. I don't know why, but that was definitely something that I learned my intern year. PGY2 was a great year. I think this is kind of the defining year in neurosurgery residency. You develop resilience. You learn that anything is possible. You develop some patient ownership, and most importantly, our Miami neurosurgery community is a family. I was able to work with Dr. Jagged. I don't know what's going on with the hair in this picture, but you look kind of good there. And Dr. Jagged, Dr. Bullock, Dr. Cote, I apologize. Is your first year as an attending, and you were kind of with me in the OR by myself, and I had the pager, and I was like always leaving the OR. And I know you weren't happy with the help you got, but I think, we got the cases done, and I learned a lot operating with you that year. So I appreciate that. This is, this is a highlight of one night in Miami as a junior resident. Everybody has this story, and I think, when you guys graduate, you'll remember these stories. But I remember I was doing a hemicranie for like a subdural, it was just me as a PGY2 with Ignacio, and this is right before we're putting this. You can see the brain swelling a lot, and I was putting this EVD catheter, and this patient didn't do too well. But then the second, I guess that night, there's a cranioplasty for Dr. Benveniste, who had a big subepidural hematoma. I call Dr. Benveniste. I was like, "Oh, Dr. Benveniste, the patient needs to go lower." He's like, "Yeah, get the patient out, get the patient out, get the patient out." I was like, "Okay." So he's like, "Go, go, go, go." We're taking out the hematoma. I call Brandon Gaynor, who's nowhere to be found, doesn't pick up the phone. I'm like, "Okay, there's no chief available." I'm by myself with a pager. I'm doing this case. I was like, "Okay, I feel like I'm really matured a lot." Meanwhile, I get a phone call from ER, and this is a patient who comes in with a creatinine of 9 and the potassium of 10 or something something incompatible with life. And there's this epidural hematoma. And as Dr. Vanny's on call, I was like, "Dr. Vanny, this patient's paraplegic. We need to probably do something." He's like, "Yeah." He's like, "We need to go to the OR." I was like, "Yeah." So I call anesthesia. Anesthesia's like, "No, absolutely not. We will not take this patient to the OR. He's going to die on the table. The patient needs dialysis." So I was like, "Okay." So, I ended up I got the patient in the OR, and we ended up doing intra-op dialysis prone, doing this, this thing. And that kind of showed you that anything's possible. You just got to get the job done. Message to Garcia, and that case was immediate. I remember I had to go walk over to that case, and from this epidural hematoma immediately, and it was just quite a night. And that kind of summarized, I think, residency in general, that you just got to get the job done. PGY3 was interesting. Had a lot of interesting patients. Learned a lot on peds. I couldn't find a picture of Andrew Middleton. He was a chief, so if you Google it, you actually cannot find a picture of him. This is an infamous story. I ended up closing a case at peds, and we left a rainy clip underneath the bone. And I remember just doubting and everything. I was like, "No, there's no way we did anything wrong. Absolutely not." I was like, "This is ridiculous. You guys are being crazy." And Dr. Bhatti's like, "Man, let's go down to CT, man. Just let's go to CT." I was like, "Okay." So then we go to CT scan, and of course I wanted to throw up when I saw this, but luckily he had the wherewithal to keep the patient intubated, and we ended up everything was fine, but it was just one of those things. I learned a lot from Dr. Ragib, Dr. Bhatia, Dr. Niazi, amazing teachers, teaching me the fundamentals of neurosurgery, importance of good operative technique, and as you're at that age when you're learning, what they're teaching is completely instrumental. I was able to work with Benveniste and Dr. Levine, and those, I think they taught me a lot about the idea of properly working up a patient and kind of giving yourself ownership at the VA, which was extremely important. Dr. Vanny, I did a lot of Coflex with you this year, and I think we had a good time. I think you were kind of, I think you taught me to steady my hand a little bit each time I took some bites, and I kind of learned the importance of not getting a durotomy and or dying. Exactly. I never got muscles though, so that was something I wish. As a PGY4, this is the hurricane hit. This is my street prior, and immediately afterwards kind of destroyed. I was able to spend a year in the lab doing biotherapy work. It was a pretty good defining year for me. Later that year, as Ian mentioned, Dr. Bhatia passed away, but I don't think anyone's actually dead until the ripples they cause in the world die away. And I think that everything he's taught me, I continue to live that life. PGY 5 year was a great year. You learned a lot. I think I spent a lot of time doing neuro-oncology and brain tumor research, and I think this was probably one of my favorite years of residency. Dr. Ivan, Dr. Komatar, I don't have to say, I thank you guys enough for all the mentorship you gave me and the autonomy and how much I learned that year. And this is an incredible year. And I think this is kind of where you're on this track, clueless, this is like Victor, kind of, you don't know what you don't know. You're at the bottom, naively confident. You're kind of like, this is like the whole, this is like Cater. Cater's like, he thinks he knows, but he doesn't know what he doesn't know. And then I think after PGY 3, you're kind of hit this bottom curve, and then PGY 5, you're starting kind of coming up this curve a little more. And I think that's kind of where I was at. The same year my son was born, changed our life forever. Nothing matters as much until he's born. And I think it's incredible, what that's taught me. And thankful to my wife for obviously bearing him. PGY 6 year was an amazing year as well, except COVID hit and kind of threw a wrench in everything. I have to give a special thank you to the certified ICU team of Cater, Joe, and Dr. Jagged. They took care of the ICU, that our little certified neuro ICU, and I think that was very helpful during that time when we didn't know what was going on, and I think it's underestimated how much work they did. PGY 7 year was this year is the best year of residency. This is my attending breakdown for cases per attending. I spent the most time with Dr. Levy, Dr. Green in spine, Dr. Komatar and Dr. Morkos and Dr. Ivan on cranial. And Dr. Bhatia had the most amount of PEDS cases that I did. So I feel pretty proud of that as well. As a PGY7, I think you learned you're kind of at the end of your road, and I think your temper gets pretty bad. I think I was realizing that I was becoming more and more impatient and more like kind of jaded as I went through residency. And this is a picture of, I mean, if you guys have been to UMH, this is Dr. Bloom. It's like 6 o'clock, 6:30 p.m. We intubated the patient, flipped him prone, registered, about to cut skin incision. He's like, wait, I think the tube is out. I think the tube is out. And like 4 anesthesiologists are there and the tube is perfectly in. It's like, there's no issue with it. And of course, we're sitting there for 30 minutes. Stephanie's about to blow up. And, I think you have to keep your head cool, like in these moments, and realize that, you can, that you still have control of the situation. These 5 minutes, they're painful, but you got to kind of have your head, on your shoulders. Nevertheless, the greatest part of our program is our residents, the PGY6s. I'll send you guys all personal messages just to spare everybody. But I think you guys are, we're extremely close to you guys. I think the class that we're probably closest is you guys. For the last 6 years, you have helped us out, protected us this year a lot, just because you guys are so good. The PGY5s, Roberto, Dan, Evan, I feel very comfortable and very close to you guys as well. Especially, kind of going through these cases, and you guys are all very unique in your own way. I'll send you guys messages. The 4s, I didn't get to know as well. Christian, I've known since medical school. Cater, I worked with you the most as a PGY3. I think you have a great future ahead of you. You have a great attitude. Badud, Cat, amazing as well. I think you guys have a unique experience doing your 6-1 kind of routine, and I think you guys are going to be amazing superstars in your field. So kudos to you guys. The 2s, you guys are extremely hardworking. I have never seen a class that more hardworking than you guys. You guys have a bright future ahead of you, and thank you for protecting me this year and making sure that everything's all teed up. You guys let us sleep at night, and I won't forget that. Interns, I take that back. You guys may be more hardworking than these guys. So Victor, I always give you crap, but I think you have an amazing head on your shoulders, and Sumed as well. Like, thank you again for giving me a great cranial rotation. Damien, sorry we weren't able to work together, but I'm sure I'll come back and pester you some more. Mentorship is one of the most important aspects of neurosurgery, and I don't think we highlight that enough. Let me try to move fast. These are, Dr. Green, he's a Renaissance man. I said a lot about him, and the humanitarian, the neurosurgeon. Dr. Hiros, you're the kind of father figure in neurosurgery. You kind of told us the importance of integrity. I'll never forget everything you taught me when I was an intern as a PGY2, kind of the importance of research papers, and whatever you put your name on is going in, on the record forever. And, I think everything you said to me really resonates with me. And I remember that every time I do any project or I did make patient decisions, is all those conference tidbits were all extremely important. Dr. Morkos, I learned probably the most in the shortest amount of time with you during my PGY6 cranial rotation. Every single thing you taught me like resonates, and I mentioned that every single time I do a case. I'm like, this is why Dr. Morkos does it. This is how you should do it. And I think that's not to be underestimated. The learning that I had during that rotation, and as you guys move through residency, that rotation is a 6 on cranial. You learn and grow tremendously. Dr. Levy, you are the consummate leader. I don't know how you manage a department with so many different personalities, but I'm always in awe of that. Also, being a physician scientist, and your success as a physician scientist is definitely a role model for me as well. Dr. Wang, we haven't done that many cases together, but I did a lot of cases this last couple of years with you. But you were like kind of the clinical juggernaut. I asked the fellows, like, how do you describe Dr. Wang? It's like juggernaut. He's unstoppable force. When he's going, the case is going to go, and you're an innovator, you're a motivator. And I think that every resident that's in your room, they're motivated to be the best they are at that time because of you. So Dr. Komatar, I say enough offline with you, but what you do with stem cells. I'm just kidding. No, you're a catalyst. I think if you throw you in any mixture and any kind of broth, like, you'll make whatever happens into something amazing. And I think you're a friend, role model, and I'm very thankful for that. Dr. Ivan as well. He's very unique. I think he was a fellow when I was an intern. And, I kind of followed him, when he's at UCSF, and, he like kind of lives close to my house, and he introduced Nanny. So, I'm very close to Dr. Ivan. I feel like, I'm very thankful to everything he's taught me. He has a great family life, and I always look at him, and, and I'm like, okay, well, when I'm in like 5-10 years, I kind of hope that I'm somewhat like him as well. So thank you to him. Dr. Peterson, I call him the phantom mentor, because in the PGY2, like, he kind of disappeared and he has never been to be seen again. And then Dr. Stark is kind of manipulator of time. I don't know how he has enough time to do everything he's able to do. Anyways, the best learning moments happen in between the moments, in between these times. We have to learn from our complications. This is from Dr. Hiros's presidential address. And every time you're in the OR, Dr. Stark, he's like, one time I was in New Zealand, this happened, or, someone died on the table, and, you remember those stories, and that's how you can learn from your complications. These are a few patients that, had some unfortunate events, and, you learn from these events, you learn from these episodes, and you grow from them. I don't have to go into each one of these stories, but each one of them have a unique place in my heart. So cherish your learning moments. They don't come often. Neurosurgery is a field where outcomes can be poor, cases may be simple, but have devastating complications. And what we do on a single given day may be the single most important day in the patient's life. This is like, I look at the patients who have gliomas. These are opportunities for research, opportunities for development to move the field forward. So, even though a patient has a terminal disease, this is all opportunities for you to kind of advance the field and move things forward. Neurosurgery is a field where we're constantly competing to become the apex predator. I mean, we are, as Dr. Wang says, we're Navy SEALs. We thrive by competition, survival of the fittest, in my opinion. Not only in this RVU system where, we're trying to get the most RVUs, but, they're always the evolution of academia. You got to publish or perish, get the most amount of cases. But there's some cons to this, but in general, this is mostly positive, that we all try to be the best we possibly can be. And this makes us, I think that's what makes neurosurgery very unique. Obviously, I think that every resident, and you're going through chief residency, you have to think about how areas you can improve on. And I think, I think there's a dichotomy in our program between brain and spine. And I think somewhat, that's good. I think moving forward, when you're kind of picking fellowships, but early on, I think the residents should be very, should kind of be open to both cranial and spine opportunities, and explore both of them early on. I've heard this from multiple residents. Oh, we have too many fellows. I'll tell you, as a chief resident, I love the fellows. They always protect you. They always help you. They always teach you. But I think there's somewhat of a balance. And I think that, I think our program does a pretty good job of it. And I think that, I think if you're collegial, you can learn a lot from everybody. One of my proudest moments was getting the R25. I think this was a unique moment in my life moving forward. It's kind of helped pave the path for me to go to the NIH next year and do my fellowship there, doing translational neuro-oncology. My name in Indian and Sanskrit means a blessing. And I think that this is what neurosurgery is. I'm blessed to have a family, a loving wife and a kid, and love to get the training. And I'm blessed to have the training that I received here at the University of Miami. So thank you all. Thank you to the faculty. Thank you to the residents.
Good morning. Thank you for putting up the talk. Thank you to my two co-chiefs. Those are amazing stories, and both very tough acts to follow. So I'm going to tell you my story, and a lot of it is centered here in Miami. So, but it all started back in Daytona Beach, Florida in 1988. You could hear the cars racing as I was born. Here's me as a baby. And here's the early years. I grew up in Orlando. My dad worked for Disney. My mom, who's here, worked as a realtor, and there are the three of us. I don't know why they kind of like dressed me up a little girly back then, but here in 1990, well, this is a little bit after that, but my brother was born and he joins our family. He was a bit of a wild man, and I would torture him until he started beating me in video games, and then he started doing high school wrestling. He could beat me up, and so I stopped bothering him after that. I went to high school at this really beautiful high school in Orlando called Lake Highland. It's really incredible campus. I dabbled in soccer, track, wrestling. I was unsure what I wanted to do with my life. applied kind of broadly to different colleges. Maybe I wanted to do business. So I went to Rollins College, and I went, it's quite a far trip. It's about 3.5 miles from my high school. So that's my big trek. And Rollins is, it's the oldest private college in Florida. I mean, there's older schools, but it's some random statistic that they like to say. Komentar has dubbed it the Harvard of Orlando, so I really appreciate that. It was a small liberal arts college. It was really a perfect place for me to be. And I tried to pick an easy first class. It was called Monkey Business, and it ended up being like really hard. We read all kinds of like Darwin's books, and it was a challenging class, but I'm super grateful because that kind of kickstarted my academic career. I knew I wanted to do, and I knew I wanted an academic challenge after that, and I switched to pre-med. We went on some really cool trips to the DR, and I began running and I joined the cross country team. Part of that was just a bunch of like free clothes, free shoes, and it was like the assistant basketball coach was the coach. He didn't really care too much, but we did run a lot. I started working at Orlando Regional with Dr. Linda Papa, and I had a handful of publications on biomarkers and TBI. This is my first like clinical exposure, and Dr. Papa actually trained at McGill, so it was my first experience working with Canadians, which was a positive one. Graduated in 2010. Here's my brother there, and this is my big move across the bottom of Florida. And in June 2014, drove down to Coconut Grove with a U-Haul truck, moved into this 2-bedroom house there. My roommate was Pat. He was in the law school, and we had a blast down there. Med school begins. I initially thought I wanted to do ER because maybe you could travel. Seems like that's kind of what I was thinking. But I really enjoyed anatomy, and I wanted to explore surgical fields. I started doing research with Dr. Bullock, and in my first and second years of med school, I worked in his lab. We did hypothermia research, and he had some really good Japanese neurosurgeon, a really good Japanese neurosurgeon, Shoji Okabori, that I worked with, who was awesome, and I got to help out on some papers. And he really had an open door policy, so I would just talk to him about career stuff, about neurosurgery, and he kind of got me interested in the field. And then my next clinical experience was with Dr. Wang. I don't remember how I got into the OR, but it was some OR at Jackson. He was explaining to the fellow, I remember him explaining to the fellow why we need to put an interbody in. He's like, do you want this guy to fuse? The fellow was asking if we should put an interbody in. And the two things I remember is he asked me to apply the Mayfield, and this like freaked me out. I'm like clamping the clamp on the patient's head, and he's like, harder, harder. So I didn't know what was going to happen there, but it worked out. And then he told me, like, we're going to do all these big cases, and then we're going to go to happy hour at 5. I'm like, okay, this field seems pretty wild. And I actually moved to Miami Beach somewhere in there, and would go running with Middleton all the time. And we ended up making T-shirts for the Miami Beach Run Club. We had several orthopedic surgeons. We'd all run together, and Andrew sort of brought me into the fold further. I started coming to Grand Rounds, and then I started working with Dr. Levy. We did a really nice sciatic nerve injury project together. And then I got a call like in the evening on the day we're supposed to be submitting ERAS. I was like, all right, I got a couple more hours here. Let me just get all my stuff together. And then I get a call from Dr. Levy. Hey, there's this sciatic nerve injury patient. We're going to try to enroll them in this clinical trial. Do you want to come? And it was like 9 p.m. I was like, yeah, I'm sorry. I'm working on ERAS right now. I have to submit it tonight. And then I like hung up, and after that I was like, I should probably go. Called him back, and we went to the OR. And then it was a young girl who was injured off of Key Biscayne boat propeller accident. And I remember Ramsey was there, and there was like a bunch of general surgeons. They're trying to like save the leg kind of thing. And Dr. Levy like moves everyone out of the way. Like I come in and look, everyone's looking at me. Who's this medical student here? But we ended up harvesting the cells, and I got to be involved in some really interesting research. So I appreciate that, Dr. Levy. That was a really cool start to my nerve research career. Then match day rolled around. Here's Ashish and I, and my brother and I. Really fun day. And Ashish alluded to our drama we had in med school, how we were not friends at first, but that wasn't because we didn't get along, and we've become great friends since then. Junior residency begins. I don't know where this picture came from, but this is Faraz back in front of ACC clinic with these two folks who are here cheering up kids probably. PGY 1 year, here's my rotation schedule, kind of a blur. 39 cases, lots of call, minimal sleep. Probably wasn't logging very many cases either. That was before we had our current system. PGY 2, trauma, spine, cranial, and things, became more interesting, more involvement in the OR. And I was sort of brought over to the dark side by Seth, by Dr. Wang, by many others. We had some great times. I appreciate you bringing me out, Dr. Wang. Back then, we'd, go out on the boat quite a bit. We still do. So I really appreciate that. That was a good time. Playing video games, we're playing video games with Seth in the call room. We did this nice trip to Orlando with the original Mazor company. That was a blast. Evening rounds with Dr. Green, which everyone will remember those. They could be pretty comprehensive. But Dr. Green would reward you with tickets to the Heat games. And one time, Simon Buttrick and we took this dear friend of Dr. Green's who had a stroke, and he happened to be a very well-to-do individual, and he was pretty obese, but we got him from his bed into the shower, and we gave him a sponge bath. And Dr. Green rewarded us with tickets to the Heat games. But after that, neurology would call me and say, hey, we've got a patient, they need a bath. I don't know if you're free. So the word kind of traveled about that, but it was worth it, great seats. Here's AJ and I, he was one of the ortho interns when I was a PGY 2. Here's us in the OR, Dr. Jolie, Timmer, and Seth, just, showing me the anatomy here. They went up a couple levels just to show me everything. This is a fun night. We all went to a hockey game. Dr. Levy, thank you. And these were some of the fellows at that time. And other cranial fellows, I think just because they were Canadian and hockey fans, they joined too. Just fun times on spine as a 2. Took a great vacation down to Brazil, and we got to see some sights. But this is about as close as we got to any of the sites, and this is just right outside the nightclub. We had an interesting graduation speech that year. Chad Pressmack came. He, told us a different side of neurosurgery we hadn't seen before. So that was fun. This is the year, right at the end of this year, and we submitted this research grant and got the Klein Award. I got the Klein Award. So started my kicked off my academic nerve career. We got this $10,000 grant, and I was going to, plan to use that during my research years, which we did. So that was very cool. PGY 3 starts, and we're breaking out of Jackson. Did 300 cases this year, VA, and PEDS. Found this case from the VA, must have been an ACDF, Dr. Levine and I did. So films look good. Sheesh and I hanging out here, maybe playing a little, I don't know what in the call room, but having a good time. Sheesh and I, Dr. Vanny taking a shooting, and we've been several other times. And he's got a nice gun collection. I appreciate you taking me. We went machine gun shooting one day. That was pretty wild. I love those videos that I have. My first time in Las Vegas was this year. Thanks, Dr. Wang. We went to a AANS spine section meeting in 2017. This time was off the strip, so it was at the JW. It was pretty tame. It was a good, first Vegas trip. Walter got married. That was a fun wedding at Vizcaya. This was on PEDS. PEDS was an incredible rotation, and this was just when my dad and Jennifer came down to visit. He'll be here this weekend. You get to meet him. Nice year. So then PGY 4 starts, and now my Infolded Spine Fellowship begins. Here was my rotation schedule, starting with Dr. Vanny, Dr. Levy, Green, Manzano, Wang. 276 cases. Got a taste of the clinic as well this year, which was which was honestly valuable. And I think back to some of those encounters still. Here's my first start of the Dr. Vanny rotation, learning how to properly position for a lateral, break the bed to about 90 degrees, tape them down really hard. I'm just kidding. Perfect instrumentation. I became a connoisseur of the Jackson cafeteria, and here's a nice little a pairing that you can do if you'd like to. We did some good cases. I remember this one we did with Dr. McCrae, actually, chance fracture, and she, Dr. Levy was there, and Joanna, and I'm kind of learning how to do osteotomies there. It was a nice, very really good year in the OR. Beginnings of my nerve career. This is Nick and I doing an overlimb procedure. I was more productive when I would take an in-house call, because one night Miguel and I built this little gym, so you can think of me when you use it here. Sorry. More heat games, courtesy of Dr. Green, that you can recognize the same view of the court. Appreciate it, Dr. Green. Went to Evan and Kat's wedding on New Year's. That was a really nice evening. I appreciate it. We went to a spine section in Orlando that year, and we all went to John. We went to your restaurant that time. It was a blast. I appreciate you having us there. I presented AANS in New Orleans, Steph. I don't know why, but this picture kind of cracks me up. Karthik and I, Cafe Dumont. Dr. Green, loving the O-arm. And then PGY 5-year starts, and we do our, I think maybe this was the first time I did the ninja competition at Timmer's house. And it was, instead of bench to bedside, it was bedside to bench for me. I was doing nerve research in the lab, and we had some good funding. Did a total of 179 cases, so it was still working in the OR a bit. We had new patients this year. It was these little patients, so thanks to them for all the experimentation we did. Hopefully, anyway, 120 rats, sciatic nerve transection model. Got to really practice microsurgery, honestly, and it was I really value that work there from that perspective, in addition to others. Here's my OR setup at the time. These are resilient little rats, very resistant to infection. Only had one infection, so my percentage was less than 1% for infection rate. We did secure more funding that year, and thanks Dr. Levy for letting me help you with that. And we secured a $250,000 R21 grant, which is still active and will continue to be active as I start practice, which will be great. So PGY 5-year, it was an amazing year. Went to 4 different meetings, courses. This is at a Globus course. I'm with the orthopedics resident. He's kind of over it. He's ready to get to the bar. Did some good spine and nerve cases and awesome research. We went shooting with Dr. Wang and Zhang Yun. And this was a cool shooting course in North Miami that we did. Simon's wedding, which was awesome. I got to present the Klein data. This was sort of the prelim report, and then we published the final paper this year. So then back to PGY 6, and from then on we're in the home stretch, and from there on you're back to working really hard every day in the OR, and time kind of flies. After that, it feels like these last years have gone by so quickly. 405 cases, spine first, UMH, and then onto cranial, and obviously COVID struck during this time, which was also a bit of a time warp. The experience is better each year. Somehow I have this picture of Greg and I, this graphic version of it, us doing a case, posterior cervical, I think. Got to do my first single position case. And the funny story was the patient was homeless Dave, Cote and I did. He just had like these business cards, just said homeless Dave on it. But his blood unfortunately got into my eye. So homeless Dave, and we got to do his labs, we got to do my labs, we did the whole process in the ER, but everything worked out well in the end. For a single position case though, it wasn't without its issues. So this is me working with Dr. Komatar, UMH, Jenny taking great photos for us. Later going on to Instagram. This is Ivan and I doing a nice I seem to be doing all the prion disease cases. This is a good prion disease case we did, biopsy, troubleshooting without any of the normal instruments. We thought this was good PPE at the time, but we would learn what really good PPE was later. This is a nice posterior lateral fusion I did for Dr. Wang. I just felt great about this case, and I came into the room. I'm like, oh no, I took the joints out, I harvested the bone, everything's good. And Dr. Wang's like, so you did your job, basically. And I'm like, yeah, well, everything's going well. We had a nice snuck out a last Vegas meeting. It would have been my third of residency, and this time we knew to stay on this trip. And the meeting was pretty boring. Oh, sorry. We were, this was a part of the pain section. I think we're talking about nerve pain and spinal cord stimulation, but I love the spine section. It's my favorite meeting. I want to make sure I go every year. Then COVID strikes. Here's my friend Andrew, who'll be hanging out with us this weekend too. We learned that, scarcity of toilet paper. It's just a really weird time, time to be in residency. We still managed to do 409 cases, so that was good. For some reason during COVID, there was a period where we were only doing nerve cases. I don't remember why exactly. Those were deemed to be the most urgent, but I remember just getting called in to do nerve cases here and there. Here's my early COVID PPE. For some reason, I'm wearing these lab goggles. I don't have an N95 mask on. So we knew this was not the way to go. I feel bad for the fellows and residents graduating that year, but hopefully we'll get to celebrate them this year. We had many celebrations. Here's us at Dr. Wang's house with this chicken that we were taking pictures with. Here's Angela and I and Dr. Morkos doing probably Angela's last case. I'm not sure what we're doing. Dr. Morkos is, I'm sure, getting ready to push me out of the way. And then chief year begins. And here's my rotation schedule. I really appreciate my co-chiefs and my co-residents. Everyone's been incredibly helpful this year. I mean, I asked someone to help, everyone, pretty well everyone has just been super amazing in working with 450 cases, including all my endovascular cases that I did this year. It was a really nice mix, and with a heavy focus on spine, a lot of increased autonomy, really capstone experience. I feel like I got to do the things that I set out and what I wanted to do coming in. Now we really learn how to wear good PPE. So happy for that too. We have our little spacesuits we can put on. We got to go up to Dr. Levy's house, and for our little chief retreat there was nice. We got to enjoy all the activities there. We went out on the boat, we went for a run, we took the paddle boards out. Ashish and I played chess, we played darts, we played pool, had some drinks. It was a great weekend. I got to play with some new technology at UM. Here's us using Augmetics, probably right before I asked them to remove the headset because I couldn't see anything. But I've later learned how to use the headset, and I've had good experience with it, so I'll say that. And then the robot, this is before the robot fought back the other day. Nice experience with it there. Rothrock and I and our new friend, as he put it. So this is a really cool case that Slav and I did. I think one of my favorite cases for Dr. Wang. This was this lady with an intramedullary tumor. We all worked together, and I really appreciate the experience, and she did well. We got our dog, Devin and I. This is little Rio, and he's, I don't have a son or daughter, but here's my child here. And there's Devin and I, our final rotation cranial that we've been on now, and I really appreciate the cranial tendings. Dr. Morkos, thank you so much. It's been amazing working with you. Although, you've been flexible with us, which I really appreciate. We have been, kind of sneaking away here and there to do spine cases. I wish I had this video for you. Dr. Stark, was there, and we clipped this aneurysm together. Let me place the clip, and mid clip placement, because I'm like sitting there, I'm not sure what to do, first and last aneurysm that I'm clipping. And I kind of like pulled the carotid over and the PCOM ruptured, but I hear Dr. Morkos, as he said to Nick several times that I've been watching, if the aneurysm ruptured, just close the clip. So I just closed it. Everything went fine, didn't spaz and pull my hand out or something like that. So that was a really, really nice case. Oh, I hear it in my head. So it worked out. And I literally heard it with the Lebanese accent in my head at that time. So no, I don't think so. Here's my total case breakdown. I didn't hit 1,000 spine cases, but I will get there. We're going to continue to work. 129 nerve cases, which probably includes like 20 muscle biopsies. So we did secure some good funding, total of 350,000, including the 90,000 from industry. So, I'm value added. I can say that. We did about 50 total 50 total publications, 3 cover articles, 16 chapters, which you can't really, for some reason, the shading, you don't see it so well, but the chapters probably were the most painful piece of all that. 13 great presentations. Thanks so much to the spine team. I want to thank everyone sort of individually. We'll just go quickly. I wrote some quick notes, but Dr. Levy, thanks so much. Guidance, mentorship in the OR, in research, everything you've done for me. I really, really appreciate it. From med school, from calling me the night ERAS was due. That was, thanks for working with me. Dr. Wang, again, a mentorship. You've really taken an interest in making sure I'm headed on the right track and talking with me candidly and being honest with me. I really appreciate that. And technical training and troubleshooting. I think I've learned a lot from you, just troubleshooting stuff in the OR. I think you're very, very good about that. And running an OR. That's something I'm working on. We'll see. Dr. Green, I don't know if you can hear me, but interactions with patients, sort of interactions with staff, and I would say the art of using the Kerrison, Dr. Green has mastered. Dr. Vanny, not accepting anything less than perfection. Beatles playlist for 6+ hours, the same song coming back and again and again. Hope I can continue to pick your brain in the coming years. Dr. Cote, you were a fellow when I was an intern, and I hope that when I'm in your shoes, that I'll be as facile as you are. You're an excellent surgeon, and we've learned a lot, Dr. Cote and I, together on these nerve cases with YouTube videos in the background, and it's been a really, really nice experience. And Timur, you're clearly a technical savant, and I hope to work with you in the coming years. Cranial team, and I realized I didn't put Dr. Peterson on here, but I do thank him. Dr. Peterson's been awesome, and actually he had me at Thanksgiving on my intern year. We went to his house for Thanksgiving. I remember wheeling 3 patients back and forth to CT and then going over to his house for Thanksgiving. It was a blast. Dr. Morcos, as I said, certain things you say and ways you do things, they really stick with me. And I can honestly, I hear your head sometimes when I'm doing stuff, and I hear your voice sometimes when I'm doing stuff in the OR. And we're very privileged to work with you. So thank you. Dr. Komatar, you really lead our residency program incredibly well. The energy you bring, you're incredibly supportive, always willing to listen. We can call you at any time. I really appreciate all the time you spend with us in and out of the OR, and you're kind of shown this model. I don't know if anyone can reproduce, but we appreciate you sharing your secrets. Dr. Hiros, we're incredibly lucky to have you at our conferences, and we got to work with you in the OR a bit. And I remember one of my first experiences in the OR, I was watching you and Albert Kim take out an AVM, but I wasn't sure if I wanted to do neurosurgery at the time, so I didn't stay the whole time, but you guys were still going probably late into the night. But thank you for all the pearls that you continue to impart to us. So really appreciate it. Dr. Bimanise, your teaching points, decision-making, pleasure to work within the OR. Dr. Jagged, I can just hear you saying, what about the coags? Attention to detail is incredible, and he's fun to hang out with outside the hospital. So I hope to do another boat trip with him soon. Dr. Gracioli, thank you for all the work you did during COVID. Real pleasure to work with. Carolina, you've been a great friend to me. Hope to collaborate with you next year. Dr. Stark, as she said, has a time machine and somehow is able to accomplish all the things he does. And thank you. And I want to thank him for letting me help on some of his cases. He's taught me a lot in the OR. So sorry if I missed you on that. We'll hang out this weekend. And our residents are amazing. Thanks everybody so much. Our intern's really incredible. Sumed, Sumed would find out, family details of the patient. He knows every single medical history information. What time did you get here, Sumed? Like, oh, I got here at 3:30, but it's just because, I left at midnight last night, so I wanted to get here a little bit early. Okay. Damien's been really awesome on cranial. Damien and Eva are my rockstar cranial team. Victor, excited to work with you next year. I hear really great things. Eva, we try to kick her out post call, but she won't leave. she's really, really, really hard worker. Wow, redefining hard work. She's been the bedrock of our cranial service besides Nick Kahn, who honestly has also been amazing to work with. I didn't mention the fellows, but Nick, you're awesome. I mean, keep doing what you're doing, man. You're a really incredible guy. Viggs kept me safe on spine. He was there every single weekend for a period of time, which wasn't great, but he did his thing. Silva, amazing to work with. I can call him anytime to come help in the OR. We've had some good cases together. Kat Badu Cater, Rockstar PGY3 team. Thank you guys. Aria, Josh, Christian, also our upcoming stars, and Roberto, Evan, and Dan. Roberto and I have done some great papers together. Roberto is quietly working away and writing papers this year, and so thanks to him. Dan, when he was a medical student, came to visit, and he told me, "Can I stay at your place?" And I had a studio on Miami Beach with the couch and the bed all in the same room. And he's like, "Yeah, you can stay at my place. Sure, Dan." Come to find out, he was planning to stay there for 5 days. So, so that was an interesting experience. And then Evan, I just want to say thank you for everything you did at UMH. He was always there, last one out, and he really worked super hard this year. Thanks, Evan. Our PGY sixes have been our closest residents with us. Stephanie and I started, we did cranial together. Steph would have me make the list, get her coffee, and our system worked out very well. Greg and I have worked on lots of cases together. I think Greg's going to do amazing. He's really a natural leader. Jason I love working with Jason in the OR. His temperament and we fit well together. We get through cases really smoothly. Excited to continue working with everybody. I'll be staying here, obviously. So thanks for your time. I appreciate it. Sorry if I've gone over it all. Thanks, everybody. Look forward to a good weekend.
Hey, everybody. I'll keep it pretty brief. My name's Nicholas Kahn. I'm the current fellow with the cerebrovascular and skull-based team this year with Dr. Morcos. First, congratulations to all the graduating chiefs. These are all extremely skilled surgeons, extremely good doctors. They're also pretty fun to hang around in the OR. This is actually just from yesterday. Thanks to all the residents for having me as part of your program. I know I've learned just as much from you guys as you have from me, and I could be here all day saying nice things about everyone on this slide. So just a little bit about what I did this year. So about 175 to 200 cerebrovascular skull-based cases, 60% skull-based, 40% cerebrovascular, around 40 aneurysms, 20 AVMs, 20 bypasses, meningiomas, acoustics, around 20 operative video submissions, 4 papers. All of these have been with extreme resident help and support, and lots of invited things that Dr. Morcos gets invited to that I get to participate in just because he is who he is. 3 labs with the residents. Here's some of the things that I think that I've learned during fellowship that I didn't come here with, but I think I'll leave with. I won't go through all of them, but you really do have a really good experience here. These are some of the papers that we worked on throughout the year, several operative videos through cases that we were on. Usually me and the resident that were on the case would do these together. We've done several of them, and it's a really good learning experience to go back and watch the case over. Just a few more. And these, this is really Suazo. He makes us look good, but these are all from him. And lastly, so what makes the fellowship unique? I think it's complementary with the residents. I think you learn to be a good teacher. And I hope I've learned how to be a good junior attending starting next year, be a team player, involve the residents in researching cases. The amount of autonomy, graded autonomy that you get is excellent. And then the flow zone, I think it's rare to have a master surgeon that you work with who also wants you to be a good surgeon yourself, and is focused on being a good teacher and seeing you improve. So thank you for having me here. Look forward to, you always have a friend in Tennessee.
I don't have any slides. I'll keep it short too. My name is Josh Ebikastis. I interacted with a lot of people in the department through the year, and it was an incredible fellowship year. We did about 630 cases, about half for interventions, half for diagnostics. When I figured out I was coming to Miami, I was PGY4, and Lewis Kim, who's my mentor in Seattle, was like, you know, you're going to go to Miami, you're going to work with Eric. And I was like, okay, well, should I look around? So he was like, no, this is your path. And I was like, okay, well, is it worth, but he's like, if you are interested in doing anything else, I would strongly recommend you reconsider your interest in academic neurosurgery. Like this is my decision. And I was like, okay. And so, it was a total privilege. I hadn't met Eric before, he had graduated before my time, and I came, and it was just an incredible experience, absolutely the best fellowship experience you could have. All the partners there, Dr. Stark, Dr. Yavagal, Dr. Peterson, just really, really experienced, all bring a different, unique thing to the table. The rest of the department was also a privilege to work with. I mean, I embodied so many patients of Dr. Komatar, just seeing him work from far away, but he's obviously a master of the craft, and Dr. Wang, and even getting to go to conference with Dr. Hiros and seeing Dr. Morcos at work. So it was just a real privilege to be here for the year. And I want to thank my wife, who's expecting our first child and tolerated me for the year. She was very happy in Miami while I was working. So that was a happy wife, happy life sort of thing. And I want to thank all the residents. It was awesome to work with you guys and learn from you guys. And then all the faculty, and a special thank out to Dr. Peterson. So thank you guys. Yes, I'm going to University of Louisville. I took a faculty position there, doing open endovascular neurosurgery. So.
Hi, everyone. This is Gurvinder. I'm at UM currently. I just wanted to take a few minutes and thank everyone for this year. It was an incredible year. Plus, I want to thank Dr. Komatar and Dr. Ivan for taking all this time and letting me have this opportunity to work at UM this year. It was a very busy year and very productive year. So thank you so much. I also want to thank the residents, especially Evan and all the chiefs, who I got to spend quite a bit of time this year. So thank you so much for an incredible year.